Okay, so ready to dive into the future. Today we're looking at a world without hospitals.
Yeah, a world without hospitals.
I know, right? Kind of creepy when you first hear it.
Definitely a little unsettling.
But think about it. What if we didn't even need hospitals? What if healthcare was just like built into our lives so seamlessly we didn't even notice it?
Well, that's exactly the idea. This article, The Invisible Future of Healthcare, is exploring.
Invisible healthcare?
Yeah, invisible healthcare. It basically argues that all these things are kind of pushing us in that direction, like all the new technologies and the way our economy is changing and even just how we live our lives now.
So no more giant buildings, just healthcare that's kind of all around.
Exactly. And the article actually lays out some pretty specific strategies for how we might get there.
Oh, cool. So how do we make healthcare disappear?
Well, it starts with understanding like the big changes that are driving this whole shit. And one of the biggest ones is just like who's using healthcare these days? It's not our parents' generation anymore. It's millennials and Gen Z.
Right, the digital natives.
Exactly. And they want healthcare that's like everything else in their lives, convenient, personalized, on demand.
Makes sense. They're used to having everything at their fingertips 20/47.
Right. So waiting weeks for an appointment or trying to navigate this like super complicated healthcare system, that just doesn't work for them.
Totally. And is that where wearables come in?
Yeah, exactly. I mean, we're already seeing smartwatches that can track our steps and sleep and all that. But the article takes it way further. Like, imagine AI that can analyze all that data and predict health risks years, even decades in advance.
Decades. That's wild. I mean, that's amazing, but also kind of scary. Like how much access do we really want AI to have to our personal data?
That's a totally fair question. It's something we definitely need to be thinking about. But think about the potential here. We could go from just reacting to health problems after they happen to actually preventing them before they even start.
Okay, yeah, I see that. That would be huge. And it's not just about physical health either, right? The article talks about mental health becoming like a community endeavor.
Yeah, that's one of the most interesting parts, I think. Imagine parks that are designed to promote mental well-being with sensors that can detect stress, and then AI that can offer help right then and there.
Parks that reduce stress. Okay, now that's a future I can get behind.
Right.
But okay, let's be real for a second. What happens to all the actual hospitals? Those buildings aren't just going to disappear overnight.
Well, the article talks about repurposing them. As medical technology gets smaller and cheaper, we could see things like old gas stations turning into like neighborhood health hubs.
So instead of filling up our cars, we'd be filling up on health. I love that. And it's such a smart way to reuse existing spaces.
Totally. And it all ties into this idea of personalized care environments. Technology can help create healthcare experiences that are tailored to each person's individual needs and preferences.
Like what? Give me an example.
Well, they talk about things like using augmented reality to create calming labor and delivery rooms for mothers, or like having a digital health avatar that gives you personalized feedback and encouragement based on your lifestyle choices.
Okay, so that avatar thing could either be super helpful or super creepy depending on how it's done. It does make you think, though, like at what point does all this monitoring become too much?
Yeah, that's the balance we need to figure out, right? Giving people valuable insights without making them feel like they're constantly being watched and judged.
Exactly. So we've got wearables, public spaces, repurposed buildings, personalized care. What else is on the horizon for invisible healthcare?
Well, get ready for this because the article suggests that one of the biggest changes could happen in our bathrooms.
Wait, what? Our bathrooms?
Yeah, think about it. We already have smart toilets that can analyze urine samples. The next step is adding AI to provide real-time analysis and personalized health recommendations.
Hold on. Smart toilets that can tell if we're getting sick. That's next level.
It is. It really pushes the boundaries of what we think of as healthcare, and it brings up some big questions about how all this constant monitoring will change how we see our own bodies.
You know what? That's actually a perfect place to pause for today because we're just about out of time.
Sounds good. We've covered a lot of ground, but we've only just scratched the surface of this invisible healthcare future.
Totally. There's so much more to explore. And we'll do exactly that in our next deep dive. So until then, thanks for listening.
See you next time. It really is a future with like a ton of potential. But yeah, it does raise some big questions about how all this tech is going to change our lives, like our whole relationship with being healthy.
For sure. I mean, it's cool to think about all this data and analysis, but it's also a little creepy when you think about it, especially when it's coming from our bathrooms.
Yeah, I get that. It's definitely different from how we think about healthcare now, like going to the doctor's office or the hospital. This invisible healthcare thing is about making it way more part of our everyday lives.
Okay, I see that. But what about doctors and nurses then? Are they just going to be out of a job if AI is doing all the diagnosis and monitoring?
The article actually makes a big point of saying that tech should help healthcare workers, not replace them. Like it's giving them better tools so they can do their jobs even better.
So doctors and nurses are still in the picture, but they're working with AI.
Exactly. Like imagine a doctor who can see your whole health history right there, analyze your genes, and recommend treatments that are perfect for you. That's a whole new level of personalized medicine.
Wow, okay, that does sound pretty awesome. But what about people who can't afford all this fancy tech? Or people who don't have good internet access? Are they just going to be left out of this invisible healthcare future?
That's a really important point, and the article talks about that too. It's not enough to just invent this stuff. We have to make sure everyone can use it no matter how much money they have or where they live or how tech savvy they are.
So invisible healthcare can't just be for the rich and connected. It has to be for everyone.
Right. We have to make sure we don't create this digital divide where some people benefit and others get left behind.
It sounds like a tough challenge, but also a huge opportunity, to really build a healthcare system that works for everyone.
Absolutely. And as we figure all this out, we have to keep people at the center of it all. Like tech should be there to help us, not to control us or make things less fair.
For sure. So we've talked about the good stuff and the challenges, but let's go back to something you said before about our relationship with our bodies. How's all this data and monitoring going to change the way we think about ourselves and our health?
That's where things get really interesting because right now we don't really know what's going on inside our bodies most of the time. We just kind of treat them like these mysterious black boxes.
It's true. We only really pay attention when something goes wrong.
Exactly. But with invisible healthcare, our health is being tracked all the time. So we'll have a way better understanding of how our bodies actually work.
So instead of just feeling sick, we'll be able to see like our temperature going up or our blood pressure changing.
Yeah, and that could be really empowering. It could help us make smarter choices about our health and stay motivated to take care of ourselves.
But isn't there a risk of becoming like obsessed with all that data? Like what if we start freaking out over every little change?
That's definitely possible, and it's something we need to be careful about as we design these systems. The goal is to give people information, not to stress them out.
So it's all about finding the right balance, right? Being informed but not overwhelmed.
Exactly, and that's where healthcare workers are still really important. They can help us understand all that data, offer support, and answer our questions.
So it's not just about the tech, it's about how we use it and how it fits into a bigger picture of health and well-being.
Gotta tech should be a tool that helps us live better, not something that runs our lives or creates more problems.
Well said. It sounds like invisible healthcare has a lot of potential, but we need to be smart about how we build it so it benefits everyone, not just the lucky few.
I couldn't agree more. It's complicated for sure, but it's definitely worth exploring because at the end of the day, it's about using tech to make healthcare better for everyone, more personalized, more preventative, and more fair. And that's a future we should all be fighting for.
It really is amazing to think about all the ways healthcare could change. It makes you wonder, though, are there any downsides to what this? Like, are there risks we should be thinking about with this whole invisible healthcare thing?
Well, yeah, I mean, any new technology comes with risks, especially when we're talking about something as important as healthcare. And one of the big ones that comes up a lot is data privacy.
Right, all that personal information floating around.
Yeah, exactly. With all this data being collected and analyzed, how do we make sure it stays safe and that it's not being used for the wrong reasons?
It's a good point. I mean, we've seen what can happen with data breaches in other industries. And when it's your health data on the line, the stakes are even higher.
Totally. And it's not just about hackers either. We also need to think about things like discrimination. Like could this data be used against people in some way?
That's a scary thought. So we need to make sure there are rules in place to protect people's privacy and make sure their data is being used responsibly.
Exactly. It's not just about the tech itself. It's about the laws and ethical guidelines that go along with it.
Okay, so data privacy is a big one. What about the impact on jobs? We talked about how AI could help doctors and nurses, but could it also end up replacing them?
That's a question that comes up a lot these days with all this talk about automation and AI. And yeah, there might be some shifts in the healthcare workforce, but I don't think robots are going to be taking over anytime soon.
Oh, good, because I'm not sure I'm ready for a robot doctor just yet.
Me neither. There are some things that AI just can't replace, like human compassion and empathy and the ability to think critically about complex situations.
So it's more about humans and machines working together than one replacing the other.
Exactly. AI can help with a lot of things like analyzing data and identifying patterns, but it's still going to be up to humans to make the big decisions and provide that personal touch that patients need.
Okay, that makes sense. So we've talked about some of the potential downsides, but let's end on a positive note. What are you most excited about when you think about the future of invisible healthcare?
What gets me most excited is the idea of finally being able to focus on preventing health problems instead of just reacting to them. Like imagine a world where we can catch diseases early or even stop them from developing in the first place.
That would be amazing to really be in control of our health.
Exactly. And I think this invisible healthcare revolution could make that happen for a lot of people.
Well, that's a great thought to end on. Thanks for taking us on this deep dive into the invisible hospital. It's been fascinating.
My pleasure.
And to all our listeners out there, thanks for joining us. Keep those questions coming and stay curious about the future because it's coming whether we're ready or not.
Until next time, stay well.